gone to work, and just for whatever reason, that evening at home, I didn't feel well, and it just started kind of getting worse.
Another doctor, this one in the lower valley, is also asking residents to take COVID seriously. He's battling it himself. Here's Channel 5's Rudy Mireles.
Like all healthcare workers, Dr. Jose Villalobos took every precaution to protect himself, his patients, and his family. But eventually, coronavirus caught up to him. Using the same advice he gives patients, he tried to recover at home. But after 10 days of fighting, he needed help from his peers.
I started developing a cough, and that cough got worse. And so I received a prescription from my doctor, and it didn't help. And then I received some steroids, which would be like the next thing you add. Didn't help. And then, it just kind of snowballed to where I just wasn't breathing well.
His wife took action. She told him to go to the emergency room. When he got there, he knew the process, but he didn't know how bad his health would deteriorate.
I was not near normal, and it was very, very close to the level where we would prescribe oxygen for somebody to live with, so right away they put me on oxygen, felt tremendously better.
Also a recipient of convalescent plasma, Dr. Villalobos is begging those who have had the virus to donate. He says by the time people get to the hospital, they need every bit of help they can get.
All right, the hospitalization is to do what we can do at home to pretty much save the person. Most people go to the hospital almost at the very end when they're in dire straits.
Born and raised in Brownsville, he's begging his neighbors to open their eyes. Hospitals are doing everything they can to avoid disaster, but it may be closer than people think.
But imagine that scenario where someone young like you're doing your job, you're being careful, but God forbid you got infected. And you're trying your best at home, but like me, you get to the point where you're feeling like you're suffocating. Imagine going to the hospital and they don't even have oxygen to give you. They don't have a little plastic tube of oxygen to give you because the whole hospital is full. The whole emergency room is full. The hallways are full.
It's more than just space that's a concern now. It's the hospital's most valuable resource on the line.
If the hospital is beyond its max and we're not able to be as careful because of the situation, the main workers that are taking care of the community are going to get sick as well. And I mean, it's really a crisis situation.
Dr. Villalobos added while he hopes leaders would close popular locations like the Valley's beaches, it's on every resident now to do the right thing and keep each other safe by wearing a mask, practicing good hygiene, and just staying at home to give hospitals a fighting chance to catch up. In Brownsville, Rudy Mireles, Channel 5 News at 6.